Hello, everyone, and welcome to Arthritis at Home. I'm Kelly Linvoy, ACE's VP of Communications and Public Affairs, and I'm happy to welcome back to the show ACE's Program Coordinator and PhD candidate with Arthritis Research Canada, Ms. Ellen Wang. Ellen, thanks for joining us today.
Always an honor to be here, Kelly.
We're following up today on the ACE's National Survey on Lupus. And in March of this year, we published part one analysis of our survey results. And this survey we partnered on with Lupus Canada. And what people learned in that first report was sort of a background on lupus, which for our audience is a complex autoimmune disease and affects nearly every part of life, including health, work, family, and emotional well-being. And it affects mostly women. In fact, about 90% of people living with lupus are women. And its unknown potential causes can make the diagnosis and management really, really challenging. And even though we've seen advancements in treatment, many people in Canada living with lupus today continue to face barriers to timely and appropriate care and support. And along that line of thinking, we've just published a Joint Health Insight featuring a part two analysis of some of these challenges in lupus care, focusing in on mental and sexual health. So to start off, Ellen, why was it important for ACE to focus part two of our survey analysis on these particular patient concerns?
Kelly, I think when we did the original analysis, we realized there was an overwhelming amount of open-ended responses where people took the time to not only, finish the survey, but to really elaborate on some of these topics regarding mental health, reproductive health, and intimacy. And it's interesting because it almost felt like when I was reading all of the open-end responses that people had shared was that they were glad, they were happy to share. They haven't been asked these questions previously. And because of that, I think we made that decision of this deserves to be highlighted in a part two. Instead of trying to fit everything in a part one, we now have this part two that really focuses and dives a little bit deeper. For example, patients told us that lupus affects more than their joints, their organs, and their lab tests, right? Even though that's something that we in the kind of the health and medical community really focus on, it's the effects on relationships, on family planning, on emotional health, on kind of those key decisions about family and future. And we were able to kind of ask those questions to people who perhaps haven't been asked properly before about those questions. And, what we found was just so incredible. So I think, everyone who completed that survey and really took the time to elaborate on some of their responses. Thank you for sharing those with us.
Absolutely. So in terms of these findings that you're describing, what were some of them that stood out the most for you?
Kelly, one of the most, you could say, like the most striking findings was that 80% of respondents reported experiencing whether that was anxiety, depression, or insomnia, so difficulty sleeping, that was directly related to their lupus, right? So we're saying 4 out of 5 people living with lupus.
Wow.
Another important finding was that many people didn't actually receive reproductive health guidance from their healthcare providers, despite, wanting that support. I do caveat that, one of the interesting findings that came out in those open-ended responses was that people had developed lupus during pregnancy, but because they were pregnant, some of those symptoms were kind of, that's pregnancy. Those are pregnancy symptoms. We also saw that lupus significantly affects intimacy and kind of those really close relationships for many of the respondents. And again, these conversations were rarely kind of covered in those clinical encounters and those short clinical encounters that we're used to.
Before we talk a little bit more about mental health, were there any other highlights around pregnancy and reproductive health for people living with lupus that were revealed in the survey?
Absolutely. So specifically regarding kind of the pregnancy and the family planning aspect,
Yeah.
people told us that it can be very medically as well as emotionally complex for those living with lupus because everyone has different symptoms. Those symptoms, like we said, overlap with many of the symptoms related to pregnancy. Then there's the idea, the fear of having disease flares. There's the fear of medication safety. Am I allowed to take my lupus medications during pregnancy? Does that affect the baby at all? Because, now we have evidence that it is safe, but previously there absolutely was no evidence. And some of this evidence is coming out of Arthritis Research Canada with Dr. Mary De Vera as well as Dr. Nada Amiri who are doing this, as well as miscarriages, blood clot disorders, and then just all around kind of higher risk pregnancies that it felt like people were saying that they weren't asked and they didn't feel supported, which is really difficult.
Looking at mental health, why do you think mental health support remains such a major gap in lupus care?
You know, Perhaps this is something that's more broad, not just lupus care, but it seems that patients were telling us that, one aspect of the challenge is that physical health and mental health seem to be addressed kind of separately within the healthcare system, right? Instead of in this kind of more integrated approach we hope in future. For those living with lupus, the emotional burden is deeply connected to the physical manifestations of the disease, right? For example, chronic pain, fatigue affects every part of life. It doesn't just affect your ability to get to the gym, to do your job. It affects the relationships, as we kind of shared previously. At the same time, many people face barriers accessing mental health services, especially in rural and underserved communities. And this is something comes up over and over again in our surveys, right? That yes, there are resources being put in place, but it is still so hard for so many communities. And finally, I think the survey really makes clear that mental health needs to be treated as really a core component of lupus, right? It's not an optional add-on. And perhaps whether that's, with training of healthcare providers to have that in the education, in rheumatology education, or to have more integrated health care teams with someone who specializes in mental health on the care team. I don't know what that would look like in future, but it's something to really push for.
That's interesting because, as you all know, because you and I have worked on it together, we do have a program called Joint Health Education. And one of the main focuses or themes of the courses that we've done in that program is really the central or core of it is about having the conversation, to be able to be one of the leaders of your healthcare team and be able to have open conversations with your healthcare providers. And this seems to be maybe one of those areas where people struggle to have a conversation when we're talking about mental health or intimacy or sexual well-being. Patients having that conversation with a rheumatologist or family doctor or other healthcare provider. I mean, these are obviously deeply personal issues, and we can, well imagine that there's some discomfort, some uncertainty, or even embarrassment, not just on the part of the patient, but I've talked to a lot of rheumatologists who say they kind of struggle to have this conversation with their patients as well. Did this resonate with what patients were reporting in the survey?
Oh, absolutely. You know, Anxiety, depression being one aspect that's very hard to bring up, especially if there's a lack of training from the part of the healthcare provider or there's that shame from the part of the patient. But also, I think pregnancy is a really unique time, right? Changes in body image are huge, and we know this, right? There is absolutely research in that specific area. as well as what we said, the intimacy in the relationships. Patients find it hard to bring up. And then you add on, Kelly, that the appointments are so short. And then as soon as you walk in, the healthcare provider has your blood work pulled up and they want to discuss your iron levels or your folate levels. Because that is not to say that isn't important, but that does come first in the way that our healthcare system is built. And of course, there is a fear of patients have expressed that they're afraid that if they bring that up in a rheumatology appointment, that they're not going to be taken seriously, right? Is it maybe because it's just a part of pregnancy? So, some of the resources that we've created Arthritis Consumer Experts has created has really helped to, get the conversation started. But as the conversation goes, some of those specific issues need to be really tackled from both ends, right? The healthcare providers also need to become comfortable, whether that's, again, training be embedded in their education on the mental health, on the sexual health, as well as, perhaps making those appointment times a little bit longer. If one of the patients is pregnant in this case and expecting, is that something that we can accommodate? And I say absolutely yes. I think when we make that investment up front, that will actually save us as a healthcare system, right? As a community, as a team, hopefully way more anguish down the line. So again, small changes in something that we need to continue to push for from both sides of the equation.
That's excellent, Ellen. I think what I'm sort of the undercurrent that I'm hearing in your answers and the findings that you're sharing is really the power behind these national surveys that ACE conducts, in that they they provide us this really important roadmap for improving arthritis care in Canada by listening really carefully and directly to what patients say they need the most. And I think in this case, in the lupus survey, and certainly in the part two findings that you shared with us, it's clear that what people with lupus are asking for is care that reflects their real world experience, not just the disease activity, but what they're experiencing and some of the things that maybe they don't normally have a chance to talk about in the course of their conversations with their healthcare provider. So, Alan, you and I and the rest of the team at ACE, we're going to continue, I think, to look at ways how we can integrate these issues, these concerns like mental health support and reproductive health discussions, conversations about intimacy and relationships into practical routine care for people with lupus. So thank you so much for joining us today, Ellen, and sharing some really important findings from our latest survey.
Thank you so much for having me, Kelly, and it's always a pleasure to work with the team and to work with yourself. And again, I thank everyone who completed the survey and really, shared some uncomfortable experiences with us. We really couldn't do this without you. So thank you to our audience and thank you to everyone who completed the survey.
Fantastic, and thank you to everyone, as Ellen mentioned, for joining us today. We're going to have links to these two different Joint Health Insights special editions on our lupus survey. So look for those at the end of the interview. And we look forward to seeing you again on another episode of Arthritis at Home. Bye for now.